Welcome back to the Parkinson's Doctor channel. My name is Dr. Ramon Rodriguez, movement disorders neurologist in Orlando, Florida, at the Neurology One Clinic. And today I have a presentation titled Stepping into the Spotlight, Addressing the Challenges of Parkinson's Disease. And this is a presentation I did yesterday, September 30, 2023, at the first annual symposium of Parkinson's disease in St. Augustine, Florida. It was very well attended. There was a lot of people, and they actually gave me a lot of feedback that they really liked this presentation and they would like to have access in the future. So what I did is I said, let me go ahead and re-record this presentation. I'm just going to do a little bit of a shorter presentation this time. However, I will have the same information. I have the very same slides I used in the presentation yesterday, and I feel that most people are going to benefit from this. So let's go ahead and get into this. To begin, let me go over the objectives of this presentation, which is to understand the prevalence of Parkinson's disease, how difficult it is to make the diagnosis sometimes, the challenges finding disease-modifying therapies, and the challenge of the suboptimal response to medicines. Understanding that Parkinson's disease treatment does not rely only on medicines. This is very important. I will spend a little bit more of time on this. The challenges in developing new medicines and the future directions in Parkinson's disease. So to begin, there's about 1 million people with Parkinson's disease in the United States, and this number just keeps growing and growing. And I think, and the estimates are that we will have between 1.2 and 1.5 million people with Parkinson's disease just in the United States alone. There's about 10 million people with Parkinson's disease estimated in the world. And the truth is that people are living longer. So as people live longer, we're going to see more and more people with Parkinson's disease. And every year we diagnose about 90,000 people with Parkinson's. And if we take these numbers and we look at them in detail, this means that we're diagnosing one person with Parkinson's disease about every 6 seconds. So this is a very common condition. And this is posing a really big challenge to the healthcare system in first place because there are not many movement disorder specialists. There's only about 800 movement disorder specialists in the United States. And if we're talking about 1.2 to 1.5 million of people with Parkinson's disease, that means that not everybody will be able to see the specialist that dedicates time and research and that has the expertise about this condition. So we really need to address this particular issue, having more doctors, learning more about Parkinson's disease. And the goal of this forum is actually to bring some of this very important information to the patients or caregivers, especially if they do not have access to see a movement disorder specialist. So when we speak about the challenge of diagnosing Parkinson's disease, the main challenge is that we don't have a blood test for Parkinson's. There is not a Parkinson's disease test, positive or negative. And what I mean by this is that we do not have what we call a biomarker, something that tells me that that person has Parkinson's disease. And even the most recent test that was reported by the Michael J. Fox Foundation, it is not 100% diagnostic of Parkinson's disease, although it is very useful. And it provides that first step for us to be able to create another test on top of this that will be able to make the process of making the diagnosis of Parkinson's disease easy. Be aware that the MRI of the brain and the DAT scan that your doctor typically orders when you go to the clinics, those tests are not diagnostic of Parkinson's disease. We order that to rule out vascular conditions, strokes, brain tumors, demyelinations, and then the DAT scan, what it does is it shows that there is a disorder of dopamine deficiency, but it is not diagnostic of Parkinson's disease. The best use of a DAT scan is to differentiate Parkinson's disease from essential tremors. However, the DAT scan will not differentiate between Parkinson's disease and the secondary Parkinsonian syndrome, or what we call the Parkinson's plus syndrome. And as of today, and today is October 1st, 2023, there is no commercial or research-based diagnostic testing that can differentiate Parkinson's disease from other Parkinsonian syndrome. Now, having said that, at the end of August, I was part of the International Congress of Parkinson's Disease and Movement Disorders in Copenhagen, Denmark. And I'm quite excited because there were a few groups working on blood testing that will help us differentiate Parkinson's disease from this other Parkinsonian syndrome. So this is coming. However, as of today, it is not available yet. The other challenge is about disease-modifying therapies. And when I speak about disease-modifying therapies, I'm speaking about medications or treatments that can help slow down or prevent the progression of Parkinson's disease. So as we were talking, that this is a condition of older people, and just imagine if we can come up with a treatment that will let you live as long as you're going to live, and you will never meet the end point where you will need to use a wheelchair, you will need to go to a nursing home or meet those outcomes, right? So this is a big deal, and we are really trying hard to find medications that can help slow down the progression of Parkinson's. We have used multiple things such as coenzyme Q10, creatinine, and some other medicines for diabetes, but as of today, we do not have a treatment that has been proven to slow down Parkinson's. However, let me tell you that we are knocking the door to find something like this. I am very excited, and I am hoping that within the next 2 to 5 years, we're going to see some medicines that we will have the evidence that they can slow down the progression of Parkinson's. The most difficult thing is that because we do not have a test that tells me that I am slowing down Parkinson's. If I have a test that tells me that the Parkinson is at the level 10, and then I do my intervention, which is giving a medicine, and then I recheck them 6 months or a year later, and from 10 it went down to 5, meaning that we're decreasing the Parkinson's, then that really will be helpful. But that test is not available yet. So we're working very hard on this, and I believe that you have really good candidates, but the problem has been how to prove this with certainty to make sure that the regulatory agencies like the FDA in the United States and the EMEA in Europe will be able to approve these kind of treatments and for the masses, for everybody that is suffering from Parkinson's disease. Another thing that we spoke about yesterday was about suboptimal response to medicines, and many people in the early stages of Parkinson's disease, they begin to take their medicines. They respond very well to the therapies. The walking is better. The tremors are better. However, with progression of Parkinson's disease over time, some people will begin to experience motor fluctuations and dyskinesias, which are two complications of more advancing Parkinson's disease. And these are cases where the medications now have an unpredictable response or unpredictable benefit. And sometimes the medicine might be associated with those involuntary movements, which sometimes can be painful. So when we face these suboptimal responses, this is the time when we begin thinking about what we're calling now device-aided therapy, such as deep brain stimulation or infusion therapies. And while medications can be very effective in those early stages, when the condition is advancing, we need better way to deliver carbidopa, levodopa, or the other medicines for Parkinson's disease, or we need to recur to a surgery that will be able to help modify what is happening in the brain in order to control the symptoms of Parkinson's disease. The other thing that we spoke about yesterday is the importance of a multidisciplinary approach to Parkinson's disease. And what I mean by this is that treating Parkinson's goes much beyond medicines. And we need the help of multiple healthcare professionals to improve the lives of the people that have Parkinson's disease. And when I talk about other healthcare professionals here, I'm talking about physical therapy, occupational therapy, speech pathologists, sometimes neuropsychologists, driver specialists, psychiatrists, neurosurgeon, gastroenterologists, and some people even dermatologists, right? Sometimes people with Parkinson's disease will have skin issues. So we need to make sure that we have a team built up that understands Parkinson's disease better. But I'm going to pay more attention today on physical therapy, occupational therapy, and speech pathology. And the role is that we want to minimize falls, we want to improve the quality of life, and we want people to stay home, being able to stay home, not ending up in the hospital, not ending up in nursing homes. So I believe, and we all believe, that through exercise and balance training, physical therapies are able to help people with Parkinson's disease walk better and with more confidence. The occupational therapies teach people with Parkinson's how to do daily tasks in a way that is safe and efficient. And speech pathologists, on the other hand, help manage speech, help monitor for swallowing difficulties. And this is very important. And it's so important to have a baseline evaluation with the speech and swallow therapies. Number one, because aspiration pneumonia is the most common cause of death in people with Parkinson's disease. And if you have aspiration pneumonia, you can live another 20 years as long as we're doing the proper management and the proper monitoring for this condition. So we need to know where you're at to be able to monitor what is it that you're going. So that is why we as movement disorder specialists recommend to have a baseline evaluation for people with Parkinson's disease. And then over time, as some of these symptoms appear, we will be able to compare with that baseline assessment. The other thing is, what are the challenges when it comes to developing new medicines? And the main challenge is, number one, lack of funding. We need more money to test these medicines, and that's why these big foundations like the Michael J. Fox Foundation, Parkinson's Foundations, and others, they're doing a phenomenal job trying to provide money. However, it's not fast enough. The amount of money that they're able to raise, and this is something that we need all to get together to raise awareness about Parkinson's disease and the importance of raising money with the local governments. Now, the second major obstacle is that when we have medicines that we believe might be helpful, I feel there is a lack of understanding surrounding clinical trials. And now, the second part goes on the people that have Parkinson's disease that might be able to participate in this clinical study. This has led to a reluctance of people to participate in clinical studies. Everybody wants the new treatments, everybody wants the new medicines, but not everybody wants to participate in the clinical trial. So the message for you today is, more people needs to get involved in the clinical trials, and by doing so, we, the researchers, are able to gain better understanding of this condition and develop new treatments. I have to tell you that many treatments for Parkinson's disease, and not only Parkinson's, many other conditions, we are never able to answer the question how well they can help people because they shut down, they close because there is not enough participation from the public to be able to answer the questions about how well these medicines can work. Now, what are the future directions in Parkinson's disease? So in the next year alone, there are some new exciting therapies that I hope they will be approved that can help delay the need for brain surgery. So the brain surgery is a fantastic treatment for people with Parkinson's disease. However, not everybody is interested in brain surgery. And then if we can delay the progression to the brain surgery, I feel that this is much better. So the one thing that is coming next year, and that I'm hoping that will be coming next year, are infusion therapies for both carbidopa, levodopa, and apomorphine. So these medications have already been submitted to the Food and Drug Administration. Apomorphine is already available in Europe, and the carbidopa, levodopa infusion, the drug is approved in Europe. They are waiting for the pump to be approved. However, this will, I believe it will make a significant impact, offering a new way to treat people with Parkinson's disease. And then I'm looking forward to a medication called prasinezumab. And prasinezumab, to some extent, is a medication fairly similar to the treatment for Alzheimer's disease that was recently approved to slow down the progression of the condition. So this is a medication that we believe might help slow down the progression of the motor symptoms of Parkinson's. So we're hearing about this. There are multiple abstracts presented at the recent meeting that shows a lot of excitement regarding slowing down the progression of Parkinson's. There are some medicines as well that are being tested that can help slow down Parkinson's disease. So I know that more studies will be done next year, meaning that maybe they will be approved within the next 3 to 4 years. So once again, we need to participate in these studies right now in order to be able to enjoy these medicines in the future. So once again, this is just a a very quick presentation, and I hope that it sparks some curiosity and keep coming back to the Parkinson's Doctor YouTube channel. My plan is to go ahead and go now more in depth into each of these areas for those of you that might be interested to learn a little bit more. And then I want to remind you that the second edition of my book, Troubleshooting Parkinson's, is already available on Amazon. And you can use the QR code. Just point your camera to the QR code. It will take you to the Amazon page where you might be able to access the book. It's available as a paperback in print, and it's available also as a digital edition on Kindle. So you might have both options to be able to access this book. And it's actually available, I think, in almost every market all over the world. So once again, thank you very much for your attention. I hope that you learned something from this. And I'm planning to bring some other new videos as well for you all to learn. I know that the past 3 to 4 weeks, I wasn't able to upload a video because I was in Copenhagen at the Movement Disorders Congress. And then after coming back, trying to catch up with the clinic and catching up with the family as well. But we're back, and we are taking back our videos almost on a weekly basis. And also remember that we have the Learn About Parkinson's blog, learnaboutparkinson.com. And right there, almost on a weekly basis, we're putting a lot of new information as well about symptoms of Parkinson's and other manuscripts and information that will help you understand better Parkinson's disease. Once again, thank you very much. Make sure that you subscribe to our channel. And until the next time, thank you.